I'm a pre-doc fellow at the SPHR, and I've been involved in the COVID-19 social study at UCL. I've been specifically looking at the mental health of parents during the pandemic, and these are parents of young children aged under 12. So the background to this study, we recognise that parents have faced unique challenges during the pandemic, not least because of the limitations to movement, the need to work from home, and also the closure of schools and changes to childcare arrangements. It was a semi-structured interview study where we interviewed 29 parents of young children. We conducted the interviews either via video conferencing or telephone, all with sound recorded and transcribed verbatim. We analysed the data using thematic analysis on in vivo software. So there were 5 themes identified across mental health. Firstly, disruption to home life. We recognised that parents often had to make decisions and choices within the home. For example, this mother wasn't able to work at all because she had 4 children at home and had to look after them. That had meant an impact on her income. There were also changes to usual support networks. So in addition to having the children at home, parents were unable to use their usual support networks that they would sometimes rely on to be able to get to work. So one dad described how his wife was unable to work because she had to look after the children, and he felt he had the easier run of it getting into his work. Parents had to navigate multiple responsibilities and changes within the home. The clash of homeschooling, childcare, work, and managing the household all under the same roof became very difficult. One dad felt that he wasn't really managing to get his job done while the children were at home. Another mum who had slightly older children who were able to attend to their own homeschooling also felt that she was being neglectful. She felt that the changes in relationships were difficult to navigate by being on back-to-back calls with work. She felt that she wasn't able to give her children the attention that she would have liked. But we did recognise that parents adopted strategies to cope. One mum described how she would just try and get out for a walk every evening, whether to talk on the phone or just to be alone and have some space from her family and household. The paper has been written up and we're about to submit it for peer review for publication. And I've also submitted an abstract to a conference. What's been great about working in this team is that I've been able to undertake a much larger scale qualitative project than I've ever been involved in before. And by working in a team, we've managed to turn that around, a big data set, in quite a short period of time, just a few months. The information has been disseminated in the news via podcasts and radios, ministerial briefings, and accessible videos and podcasts. Thanks for listening.